How can technology reduce costs and improve patient care? That's the most important question clinicians are asking themselves today in a post-EHR world. In a world where patients have supercomputers in their pockets and are used to the user experiences of the Apples, the Googles, the Facebooks, and the Snapchats. In a world where clinicians are spending more time in front of a computer screen than in front of a patient. In a world where sensors and wearables are collecting just an incredible plethora of new digital health data, some of it useful, but much of it useless, and none of it fitting within the current EHR infrastructure. In a world where innovators have access to capital and technology to transform healthcare, there's something slowing the industry down. There's something preventing technology from transforming healthcare. In a series with experts, we asked that question. What's preventing technology from transforming healthcare today? We've compiled those interviews into a set of resources that we hope you find valuable.
Thank you, everybody, for joining us today. My name is Mark Olszewski, and I'm the Chief Data Officer at Danica. And today we're going to be presenting to you the Digital Health Success Framework, which is a guide that we wrote for the makers of digital healthcare products. A bit about me and maybe my background on how I got involved with Danica Digital Health and some of the color that I'll be adding to the presentation today. So I've been working in healthcare technology for 10 years. I ran hospital implementation projects at Epic for 4 years, where I not only worked on the main ambulatory EHR, but also on new products in oncology and cardiology. I was a technical startup founder where my company built products for the safety net. And through that startup, I participated in the 4th class of Rock Health, which was at the time an incubator based in San Francisco. I've worked for startups in other verticals. So for a year, I actually stepped out of digital health and I worked for an art company. And I worked for a startup trying to build a social network. So I know what it's like to go from working in healthcare to working in not healthcare. And it gives me a bit of understanding as well of knowing what some challenges of somebody who hadn't worked in healthcare before, but who is used to building products and apps would experience. And I joined Danica in 2014, so 3.5 years ago, where I lead up data strategy and developer outreach. To know about the Digital Health Success Framework, it also helps to go over Danica. And you might know a bit about us just through signing up for the webinar. But our company was founded in 2013, and the Danica platform is the one sole platform that's needed for everybody in digital health to build applications. We have 200 customers across all major verticals, so vendors, hospital systems, and clinics, life sciences and pharma, and payers. And we're trusted by organizations like J&J, Stony Brook University Medical Center, and the VA to ensure compliance and success in the cloud. So again, the reason we're here today is to discuss the Digital Health Success Framework. When we were working on what it took to be the comprehensive platform of what it took to help companies in digital health, we realized that we had competency and we were helping our customers with hosting and with compliance, with integration, but we realized that we needed to take this back even another step, where a lot of the people who were coming in the door, asking us questions, sending us emails, were just getting started on projects. They needed help taking an idea or taking some plan or taking something they put together and turning it into a very real product and turning it into a very real business. And we realized that if we were going to help our customers be successful, that we needed to do more from a content standpoint, and we needed to do more just from an educational standpoint in order to help people get off the ground and get started. And so that was the Digital Health Success Framework, as we call it for short, the DHSF. And you can see it online. You could go to it at www.danica.com/DHSF. But we built it from talking to over 4,000 conversations with customers, leads, people coming in through the website, or that we had conversations with at conferences. So it's pretty battle tested when we realized that what we were doing wasn't going to be enough. It was intended to be a living document and to grow. Even so the presentation we're giving today has 5 pillars, which we'll go through. We're currently working on writing a 6th one for proof. So how do you run clinical studies, clinical trials, or how do you validate that your application is actually working? It was written between me and you know some of my background, Dr. Travis Good, who's our CEO, who also has a significant amount of application healthcare and startup experience, and Chris Gosser, who as our VP of Marketing is doing a lot of our work engaging with customers as they're coming inbound as we try and help them with solutions in order to be successful. One thing worth noting is that this isn't a substitute for other startup or business wisdom. If you need to learn things about how to structure your cap table, how to raise a VC, how to structure your early startup team, there's plenty of great resources through Y Combinator, 500 Startups, blogs like those written by some people in the VC space. There's plenty of information out there for startup things, and of course, as always, it's worthwhile finding a mentor who's done something like this first. If you're in startups, relying on your local startup scene. If you're in business, going through somebody within your company who's launched a product like this before, or trying to find somebody who has. So when we talk about the Digital Health Success Framework, if you take a look at it on the website, we've split it into these 5 pillars: compliance, infrastructure, application requirements, integration needs, and the pilot. And we split it out on a timeline over 48 months. So what you need to do over 4 years to be successful. But what we're going to talk about specifically today is the first 12 months of what it takes to get something done. Since this is really the critical point while your product and while your business is in gestation. And these are the reasons why the first 12 months are specifically important. First, if you haven't worked on a product in the healthcare space before, knowing all the rules of the game is very hard to do. And they're not always very transparent in healthcare. There isn't a guide before the DHSF, of course, that just said, this is everything you need to do. If you've never worked in healthcare, this is how to understand it. Here's how to understand the hierarchical nature of healthcare, how doctors, system administrators, payers, how this all works. Go to it. And so if you're going to succeed in healthcare, you have to pick up the rules of the game and pretty quickly. The second thing is that it's hard when you're starting a new company, but it's also hard for new products getting started in the Fortune 50, just in very different ways. You know, if you're a large pharmaceutical company, if you've never dealt with PHI before, you have a lot of risk you're incurring in building products that manage PHI, since you have very real stakes on the table. But as most people in pharma and life sciences are finding, that patient-specific data is required for the next generation of these life sciences solutions. So they have to figure it out. Again, they just have very different problems than a doctor and a programmer getting together and building an app to make their clinic work better. As always, as with all things, I think it's Paul Graham who says that most startups will fail. And you can try your hardest in doing it, but in order to succeed or to optimize your likelihood of success, you really need to focus on the right items. And if you focus on the wrong items, it'll lead to failure. And it may be a sales failure in which you might not be able to sell your product to anybody. It might be a product failure by which your product won't meet the needs of an organization. And the one thing I tell people, and it's always kind of heartbreaking in healthcare, because there's so many people out there that are trying to do the right thing. People who are trying to build applications that'll make doctors' lives better, that'll make patients' lives better. But the thing is that that's everybody who's working in the industry. Everyone is trying to build apps to make things better. And there's so many low-hanging fruits in healthcare in order to improve things that it's very hard to differentiate yourself from doing it. I remember when I was in Rock Health sitting down with Brian Poger, who had been around the block a few times as an entrepreneur, and I was telling him, we built this product and it routes people to clinics so they don't show up in emergency departments, and it's great. And he's like, I totally understand the value of the product, but how is this a business? How are you going to sell it? How is it going to work? And how are you going to prove to people the value of it? And you need somebody to ask you the hard questions of that. And again, it could be your mentors, it could be people in your incubator. But you really need to make sure that you have a plan for the business that'll succeed past the goodwill you're trying to achieve with the mission of your product and your company. And that needs to be hashed out pretty quickly into your process. So we'll go through these pillars, and I'll give some color commentary of what needs to be done in the first 12 months. And we'll start here, and maybe it's our bias as a company that focuses wholly on compliance, is compliance. Understanding what HIPAA is and how to make it work best for your company, especially against other products that can't demonstrate compliance. HIPAA and the amendments to HIPAA through the HITECH Act in 2013 dictate how patient information, or PHI, protected healthcare information, needs to be protected. And for better or worse, healthcare is really regulated as an industry. HIPAA dictates some of that, requirements from healthcare organizations dictate the rest. And we believe that you really need to start with compliance, because if you can't, other than maybe a pilot to a very small clinic, somebody who might not be too concerned with scale, you really can't get much of a foothold anywhere if you can't demonstrate compliance. So we recommend that people start here first. And so there's 4 items that need to be done in the first year. First, determining if HIPAA matters to you. Do you need to deal with PHI? In month number 3 is understanding business associate agreements, or BAAs, and coming up with your own for your business. At month 6, beginning to assess going through an audit to formally prove your compliance as an organization and for your product. And finally, in month number 12, going through your first audit, so kicking off the official path to compliance. So the first thing you need to do is determine whether or not HIPAA matters to you. And I have a little story I'd like to tell about how hard this can be, how very not obvious it is. So a few months ago, a software developer based here in Madison was the technical liaison to a company that had a really nifty device. It was a smart sensor that you could put into food, and it would determine the allergens that are in it. So if you had food allergies, something like peanuts, shellfish, it could identify the allergens and could let you know, so you would avoid having an allergic reaction. You just wouldn't eat it. Brilliant products, very smart team, top biologists based of people here from UW and across the country. And another software developer from a dev shop reaches out to me and says, hey, you should talk to Andrew. Somebody's telling him that he needs to deal with PHI, and it's going to cost him a lot of money to do it, and it doesn't sound right. So Andrew comes into the office and we meet, and he tells me about his product, and he tells me that another vendor in the space, a backend as a service vendor, is telling them that their data is PHI. They need to protect it. If they don't, they're going to get fined by the government. And the solution to their problem was giving this backend as a service vendor $2,000 a month to solve it. And if they didn't, bad things were going to happen to him. And so I start going down the list where, who generates data for the devices? And he says, well, it's the people using them. We sell them directly to just regular consumers on the market. I asked him if he had any intent in the near future to sell this to doctors or through some plan to doctors or a payer. And he says no. I ask him if they have any information to be able to share that data directly with providers to be able to prescribe this device, and he says no. And I tell him, well, you don't have a PHI problem at all. Patient-generated or person-generated data is not PHI. It's not covered under HIPAA whatsoever. You right now could go out into the street and you could just start telling people your health record, your medications, your problem list, your visits, when you've been admitted to the hospital, and that is not covered under HIPAA. And so it's very important to know this, that again, here was a person that was this close, inches away, to cutting somebody a pretty big check for something monthly, for a product they didn't need whatsoever, for something that didn't pertain to them. And so the first thing you really need to do is determine, does HIPAA matter to you? And there's a few things in understanding that. First, what is protected health information? Are you dealing with PHI information that it can identify an individual, or is it just general high-level data? Is it de-identified claims? Is it geographic data? What are you actually working with? Is it clinician schedules? Something that's not PHI. And part of understanding that is if you are a covered entity or business associate. So covered entities are typically caregivers, payers, and employers, and business associates are the vendors who work with them. So in most cases, Danica is a business associate when we work with covered entities, or we're a subcontractor of a business associate when we work with vendors. And ultimately determining if you will need to handle PHI to be successful. And at first, especially as you're beginning on a new product, you may not. If you're in the big data space, if you're doing actuarial work, if you're working on provider optimization, you may not need to handle PHI at all, but you might come to a point where you eventually need to. If you have any questions about what is PHI, what are these terms, if I just said a bunch of acronyms that made your eyes glaze over, we have a really great guide for this on our website on HIPAA compliance. You can find it from the page, or you can go to this URL here. So once you've determined if you need to deal with PHI or not, and if you determine that you do, the next step is understanding business associate agreements. So per the laws, or per the regulations of HIPAA, rather, the business associated agreement dictates how you will work with either your subcontractors or with covered entities on protecting patient data. And the reason why you need a BAA, and this was clarified in 2013 when the HITECH Act amended HIPAA, is that if you don't have a business associate agreement in place, you take on liability for anything not dictated in it. You take responsibility for it. So in the past, it was vague that if you use some service and there was PHI in it, was it your fault, was it their fault? If you don't have a business associate agreement in place, it's definitely your fault. You take responsibility for everything if there's no written legal agreement in place. So therefore, even if you in your pilot place of a clinic says, great, we'll give you all the patient data, we don't care, you will want to do this to be able to protect yourself. Because what a business associate agreement does is it relies on a shared responsibility model within the agreement. It clearly dictates that in order to protect patient data, what the covered entity needs to do, or the other signatory on the other side of the contract, so if you're a subcontractor to the business associate, what they need to do, and then it dictates what you will do as part of protecting PHI. It also does a few things like it may dictate liability, it may dictate what you would do in the event of a breach, and it dictates a bunch of other things. A good example of this is the BAA that we have with Amazon Web Services, or AWS, where Amazon says, we will take responsibility for the fact that if somebody runs out of our data center with your disk, we will take responsibility for that. But as a result, you have to do a bunch of things as the vendor using Amazon Web Services for us to take on responsibility for that. You can't use elastic load balancers. You are responsible for encryption on disk. You are responsible for making sure that you manage this, and these are our disaster recovery timelines. And those are pretty common. And again, your BAA might change based upon the users of your application if you provide clinicians. But this is something that you should have. And we open sourced our BAA. It's part of our policies. So you can see that online. But one thing you should also make sure of, especially if you're a startup, if you're a big company, the way that you do contracting may be a bit more rigid, but you may also be required to sign other organizations' BAAs, and coming up with your process to do that. And the one thing that I would encourage you is that, like most contracts, this is something that you could get into a bad situation pretty quickly. You may not want to agree to unlimited liability. You may not want to agree to very quick turnarounds for a breach notification or whatever it is. You need to make sure that you and everything else within your stack, your hosting providers, other third-party vendors you work with, can manage the quality of the BAA you provide to organizations. Once again, this is a pretty in-depth topic, but at a high level, you need to make sure that you understand contractually how you're going to agree to protect patient data. Around month number 6, you're going to have to start working on audits. And what we've spent a lot of time on, what the industry is starting to gravitate towards, is an audit system called HITRUST. So HIPAA, if you're not familiar, is not prescriptive as a system at all for demonstrating compliance. HIPAA tells you that you need to protect patient data. There's physical safeguards, there's technical safeguards, but it doesn't say specifically what you need to do. It says that you need to encrypt data, but it says that it doesn't say which ciphers are good. It says that you need to limit access to data, but it doesn't say what reasonable limits to data are. And as a result, more organizations are starting to rally around third-party audits. In the past, there was audits that were just for HIPAA compliance, and we've gone through those. And there's other non-industry specific audits like SOC 2, Type 1, and Type 2. But HITRUST is really starting to become the de facto standard for demonstrating healthcare compliance in the United States. And there's two good reasons for this. First of all is that it's done on an annual process, so every year while you reattest, you come up to date with what the newest trends in the industry are for proving compliance. And the second thing is that it's seen adoption from first hospital organizations, particularly in pediatrics. Second, payers. So many major insurers like Anthem, Humana will now require high trust audits if you're going to work with those organizations. And third, vendors. It's been received a lot of attention, especially for vendors. They were tired of doing one-off audits, so the fact that they could demonstrate compliance by doing one unit of work multiple times is very appealing to them. There's three phases of the high trust certification. The first is a self-assessment. Then once you're audited, there's the section where you go through that, and then there's full certification where the audit has been reviewed, specifically drilled down into, and then audited. If you have any questions about audits, how to go through them, you can see it through our guide on Danica.com, where you can read about the high trust process, how we went through it, what it cost us. But around month number 6, you should begin thinking of formal audits for organizations, where again, at this point, you may have already sold your first pilot. You might not have a problem with compliance yet, but as you look to scale, as you look to sell to 5 organizations, 10 organizations, 15 organizations, or in order to get even all users within your organization using it, you really need to be able to plan for this. And then month number 13, so 1 month outside of our first 12 months, is when you will do your first audit. And again, thinking about how long it's going to take, who needs to be involved, and how you can best prepare for it are all part of that high trust guide. So take a look at it. We put a lot of work into it. It's pretty great. So the next part of our guide is talking about infrastructure. Specifically, if you decide that you're not going to deploy your application on-premise, and you're going to do like most software developers do today, and you're going to build your application in the cloud. And there's 3 steps here in the first 12 months. It's first understanding the different requirements once PHI is involved. Next is understanding your options and what to build. So what can you do? Can you build it yourself? Do you need to rely on a vendor, somebody like Danica? And then finally, starting to understand the nuances of security and privacy, which again, it's as much knowing and doing the right things, and it's also as much being able to demonstrate that you are, since once again, in 2017 with ransomware, you might have read about the most recent attacks, you will be asked about compliance constantly. So having an ironclad game plan and building compliance security, and being able to demonstrate what you do from everybody from software developers to your salespeople to your executives will be one of your top priorities as a company. So the first thing, and especially if you haven't worked in healthcare before, and it shocked me when I wasn't working in healthcare when I was in social networking, was how little non-healthcare entities need to protect data, at least when they're starting out. And it's not to say that people shouldn't be, but honestly, there's just no ramifications for a small company if there would be some kind of a data breach. Whereas HIPAA impacts everybody immediately, whether or not you have a business associate agreement with it. If there would be some kind of a breach of healthcare information, you would be in violation of it from the government. The OCR of Health and Human Services would come after you, or the organizations would be bad, or in the worst case scenario, no one would just buy anything from you ever again. Your business, your product would pretty much be dead on arrival. In order to do this, of course, again, you need to make sure that there are no data breaches, but you're also going to have to do a bunch of new things that you might not have done before in order to protect patient data. And these are things that we outline in our open source policies, but these are things like auditing, logging, monitoring, intrusion detection, vulnerability scanning. You may need to deploy new pieces of infrastructure above just having a database and an application server, your traditional application stack. The next thing you're going to need to think about is data retention. And this can be particularly tricky because it can vary on a state-by-state level, and it can also vary on an organizational level. So some organizations may want you, after the laws of HIPAA, in order to purge certain amounts of information, they might want you to maintain some data into perpetuity. And this is important, and you probably want to have something that is very configurable that allows you to adjust this on an organization by organization or a state by state basis. And finally is disaster recovery, where especially if you have an application that is mission critical, if you're doing something like secure messaging in the hospital, telemedicine, or mission critical varieties of telemedicine, or anything that's involved in patient care, you're going to be held to very strict and specific SLAs, and they're going to want to know what happens in the event of a disaster and how you're going to come around with that. So one of the things that we need to demonstrate constantly is, do we have a disaster recovery plan? Have we gone through it? Have we tested it? And do we review it every year to make sure that if AWS loses a data center, or if something happens to Madison, that we'll be able to bring mission critical applications back up ASAP. And this right here, this is an example of a spreadsheet. This is a compliance document that we have to go through pretty often. So somebody hands you one of these with 200 questions, and you have to be able to answer all of them. Most of these map to our policies, so it's pretty easy. But you can see that, even we got this from a vendor. This was somebody who actually just came in the door that didn't convert as a customer. So we filled out this questionnaire just as the table stakes in order to have the conversation to continue sales. And you can see there was even very specific items in here to see if we had a plan for if there was a pandemic. We don't have a specific pandemic plan. We just maintain business continuity through the rest of our documented policies. But this is something that we need to do, we need to work on for all of our customers. So once you've determined the basics of the new components that you need in order to protect PHI, at this point you should start thinking about what your options are to build it. So at this point you're probably working on your application, the front end, the user experience. But the next question is, what are you going to deploy that on? And you have definitely a few different options. First are infrastructure as a service providers. So this is probably what you're most familiar with if you're building applications in the space. You have AWS, you have Azure, who will sign a BAA with you. But the biggest thing to note is that for most of these vendors, the limits of liability that they're going to take on in that BAA is just saying, we'll take responsibility if somebody runs out of the data center with your disk. Otherwise, everything else is on you, which is really 1/10, 2/10 of HIPAA. Now, that's a pretty big 1/10, 2/10. It's not to say that those are bad services. And again, we built our platform on AWS and Azure ourselves. So I mean, we can vouch they're good products, but you really need to think more about what you're going to do for the rest of the things that we discussed that you need to know in month 2. How are you going to manage vulnerability scanning on AWS? How are you going to manage intrusion detection on AWS? And what's the real cost of that in both software and in resources? The next thing are evaluating platform as a service solutions, one of which is our company, Danica, or somebody else like Heroku is kind of the classic platform as a service. So a company that might manage more of those compliance requirements, so long as you can meet their mechanism of deploying code. So for example, we build everything on the back end that minimizes developer access, so long as developers are fine using build packs, which many are. There's a few vendors in the space now. There's Kinvi, there's CloudMine, there was Parse, which was a non-HIPAA compliant solution, but these new vendors like backend as a service solutions, which on the one hand can provide a very agile development environment, but as somebody who we had a backend as a service that we used to sell at Danica as our first product, definitely has limitations as what their capabilities are from a software development standpoint. And finally, you have managed service providers. So you can outsource your ops, you can outsource a lot of what the infrastructure pieces are to somebody like Rackspace or ClearData. These use infrastructure as a service or IaaS primitives, but you're paying somebody else to manage them. And usually it's, you pay top dollar, but also you have a limitless supply of experts on hand, hypothetically speaking, in order to lead something up to build your infrastructure that way. So there's a bunch of different options. Knowing how much you want to build and how much you want to buy is something you need to consider at that point. In month number 8, now you really need to think about security and privacy, especially as you're selling this to organizations. And this data point is like, well, you had to think about security and privacy day 1, but it's really making sure that you can cogently tell your story about why it's important. Because healthcare organizations are going to care. Everybody sees in the news stories of patient breaches, stories of ransomware, and especially if you're a vendor in this space, The fact that, I still today, I think every week hear about the Nuance attack where ransomware encrypted all of the hard drives that Nuance, which is a dictation vendor, was running. You could look it up on the internet if you want to read more about it. But for months, still there's outages. Dictation services which doctors use, which again, not exactly, killing anybody, but significantly impacting physician workflow has been down. And it's bad. And Nuance was a big company. Now, not that a big company makes you any better or worse at protecting patient data or being able to secure your systems, but they had the resources to do it and they failed. So they're going to ask you, if you're a startup or you're just getting started, if you've never dealt with PHI before, is that going to be you? And you're going to have to be able to tell them that it's not. And coming up with a story of how you do it. So what do you do that nobody else in the industry does? And in fact, taking security and privacy and turning it from a weakness and turning it into a strength. And all of the work that we've done focusing on compliance for us, just bringing it down personally, has made all of the difference, where we have enough data points, we have the team, we have the expertise to demonstrate that we do it better than everybody else. And now being able to tell the story that, when you talk about the cloud, and this bit really flipped probably about last year, where, in 2014 when we started, no one in healthcare was really using the cloud. Maybe some people who were working on genomics or some other big data type initiatives. But in 2014, it was really only startups. I mean, people definitely on the fringe of things doing data work in the cloud. But now, especially in 2017, where people are starting to realize that, a 300-bed hospital, in a relatively rural area is not a small business. I mean, it probably does revenues of $100 million, $200 million, $300 million a year. It's a significant financial center. And so they're a very good, a very big opportunity for attacks. And a lot of these people are just finding that they can't maintain their own infrastructure. They can't keep up to date with all the patches and what it takes, especially whenever they juggle that with requirements to uptime. And the cloud can solve a lot of those problems. So if you decide to build your application in the cloud, making sure that if somebody says, and I had a conversation like this last week where somebody said, it has to be on-prem, we're not putting data in the cloud anywhere, explaining that that might actually be a worse idea, and how doing it in a cloud, and not just throwing something up on AWS, that's not proving compliance, but making sure that you do prove compliance, and that it's core to your company's story is very important. The next part of things is application build. So making sure that you ensure that your application meets security requirements for healthcare data. We only have one point in here during the first 12 months. And obviously your application being good, healthcare organizations wanting to use it is very important. I don't have much advice on what is a good app or what is a bad app. I've built apps that no one's used. I've built apps that a lot of people have used. It's a hard thing to get right, and if anything, if you can even get it right at the beginning, it's a hard thing to keep getting right. And I think you can see some of that through the rise and fall of Epic, where 2006, Epic, most popular EHR vendor, and now in 2017, I don't think you can find quite as many people who are out there saying as nice things about the EHR vendors. But when we're talking about applications, we're talking about understanding how and where the application is going to be used and by whom, because that has very real ramifications from a HIPAA standpoint and how you need to design things. In our soon-to-be released proof section that we're about to add to the DHSF, and a bit of a sneak preview, we also talk about getting preliminary validation from a clinical expert in the field. So if you say, hey, I think that if I had this app and we did this, that we can help patients who are pre-diabetic from becoming diabetic. At first blush, it probably makes a lot of sense, but making sure that you talk to somebody who is an expert in endocrinology, somebody who works with diabetic populations constantly will sign off on your idea, and making sure that it actually passes a sniff test, or there isn't some other clinical research that immediately invalidates your idea. But let's talk about application security. So, and this doesn't seem like it's a very hard problem. When I discuss how electronic health records work with people, I explain to them that electronic health records are like an iceberg. Clinicians see the top of it. They see how they interact with the system. They see the UI. But underneath the system, and especially Epic, you have this huge, massive functionality that dictates who can see what PHI and how your organization is going to work. And especially, this is a hard thing to get right consistently because most organizations think that they are very unique. If you work with one hospital and you do something one way, you might know that it only works that one way. How nurses and medical assistants interact with physicians, how the front desk staff interacts with those other clinicians. Maybe some of them have the same roles. Maybe it's a very small clinic where the physician and there's the nurse who's also the scheduler, who's also the person who does much of the most administrative work, and even though they're not supposed to be, even writing prescriptions for medications or tracking warfarin levels or whatever it might be. People use EHR systems a whole bunch of different ways. And the big thing that your application needs to be able to do is to dictate the right ways to be able to do that. The first thing is dictating how users are going to access the application. So how are you going to deploy this? Is it an app they can download from the App Store? Is it a website? Can the website be accessed from public networks, or can it only be accessed behind a VPN? These are the kind of things that you need to be able to think about to figure out how you're going to deploy this in the application. The next thing is thinking about how you'll provision, credential, and then deprovision users. So how are you going to onboard new users to the system, and how are you going to determine what their access and their access type is? And finally is how will you limit access to PHI in your application, and how will you manage trade-offs in emergencies? From here, you know, it's HIPAA requires you to provide reasonable safeguards to limit access to PHI in a system. This means that if you build an app for a hospital system, that if you're a doctor and a nurse in the family practice unit, that you probably should be restricted from seeing patient data in orthopedics. And if you work in orthopedics, you should be restricted from seeing data in GI, and so on and so forth. Now, there needs to be some trade-offs for this in you don't want to stop somebody from doing their job. Especially nurses can shift frequently. You might have some float work, float nurse concept. So many applications and EHRs I worked on, not withstanding to this, you need to be able to manage some kind of a trade-off in an emergency where you have some kind of break the glass functionality where anybody can see any patient record and be able to do this. Again, you probably need some auditing and logging level to make sure that you're seeing who's accessing what patient data. You know, especially you read about these incidents all the time where somebody at Cedars-Sinai steals Kim Kardashian's patient records and they find the person who looked up the data and sold it to DMZ, and then they're reprimanded. Your application needs to be able to do the exact same thing. One, because it's the law, and two, it's a very real problem. Once again, healthcare fraud, data access, people selling data on the dark webs. You need to be able to know who's accessing what data, limit it, and whenever you identify that somebody is accessing data inappropriately, be able to manage it. And if you want to know, you know, kind of like a silver lining on the cloud thing, obviously access to data is a lot easier for both good and bad. But on paper charts, no one knew who was looking at what data or photocopying or doing whatever with it anyways. So even though some things are trickier, overall, I believe we're in a way better shape due to the way that things work today in our digital environment. Talking a bit about integration and exchanging data with legacy systems, you don't reach it until the end of the first 12 months, but we do want to talk about the preliminary what you need to do to determine with data integration. First, determining if your product and your business needs data integration with existing systems and understanding those specific data and technology pieces. So in 2017, 90% of physicians use the EHR, and for better or worse, whether they like it or not, that's where most physicians and most clinicians live in. And so even though you might have an app and it might have a great user experience and it might solve a lot of needs, you need to think about how you're going to integrate with the daily clinician-patient workflow and how you're going to build those kind of applications. And the biggest thing is whether or not you need to solve integration sooner rather than later, or will documenting information in your app and then writing it back into the EHR, or managing some kind of export to fuel data into your app or fuel data from your app into the EHR, or even just having standalone applications where you don't need to push data into the EHR at all. You need to solve this problem now or later. And again, during your first pilot, probably don't need to manage data integration at all. But knowing if you do or at what scale or how it works, something you probably need to know as you head into the end of your first year in understanding electronic health records. And once again, this is something there isn't really a book on. What EHRs exist in the market? And if based on your target market, what EHRs are they going to be using? Large health systems, academic pediatrics tend to use vendors like Epic and Cerner, whereas smaller clinics and more local regional hospitals, so like 5 to 50 beds, are going to use something like Meditech, CPSI, eClinicalWorks, or Athena Health. And then knowing what integrations capabilities exist for those EHRs. Are they FHIR enabled? FHIR, which is the new health data standard from HL7, which provides APIs to systems. Is it good old-fashioned HL7 v2, that pipe delimited format? And then finally, coming down to the point of what's your value proposition to justify the cost of an integration. So, if you talk about it at a high level, the cost of integrating with the health system, your product, and again, you can slice and dice this, or you can package it into your product a bunch of different ways. It's probably going to cost somewhere between $10,000 and $15,000, at least in year number one. And if you think about it, I always compare it to, in the cost of hiring a medical assistant, at the median cost of a medical assistant salary in the country, half of an FTE of that is probably about $15,000 a year. So when you reach the point in which you need to cross that bridge with data integration, how are you going to determine that it's worthwhile? Whereas the integration is something you only use once a week or something once a month. It might not generate as much value as just, hey, have it be somebody's job to go into your app, take this data, put it into the other system, or whatever it might be. Or if the doctor needs to get data out of this one system once a week or once a month, they'll just have to access the other system. Versus if it's something that your application needs the data, if you're a telemedicine application and you want to write data back into the EHR so they can have legal continuity, your application needs integration. Your product is DOA if that doesn't work. Or if you find that, if you're going to be doing 6,000 telemedicine visits a day, you definitely don't want to do that documentation. There's no way that any one person can manage that much double documentation from your telemedicine solution into the other system. So right around the point that in which you can provide value, or in fact even make your product more worthwhile to other vendors, or especially one of the biggest things is reducing danger of adverse medical events through incorrect patient handoffs. The second that you have that moment to justify the cost of integration, you should look into building that into your solution. And it's worth noting that people will ask you about data integration to begin with. So you should have some plan above just saying yes and putting it on a wing and a prayer. But you need to make sure that that value prop lines up specifically. The final part, and we don't have this in the first 12 months, and it's actually one of the big pieces of feedback we've been getting in the DHSF so far, is that we need to push this way back. You probably need to be talking about pilots at month 3, month 6, that you're going to know if a product's good or bad by the end of year 1. But there's a few B2C endeavors in healthcare, but for the most part, most people are selling B2B or B2B2C type business models. So you're selling something to a health system, to a payer, to somebody in life sciences and pharmas. And the first thing they'll probably want you to do, especially if you're a brand new company, is setting up a pilot and working on that. And for the most part, getting that pilot is all about demonstrating the credibility. So can you be compliant and secure? Can you survive going through IRB? Determining what your metrics for success are, so what makes this a very good pilot and how can your app measure it. Making sure that you have a stakeholder on board that wants your application, your product, who's a big fan of your business. But especially at the beginning, you're going to be selling a lot of the vision. So based on the pilot, what can you prove that's good for patients, good for clinicians? But how is that going to grow so that the organization sees the benefit of that long-term relationship? And Rock Health had a really good guide on this as part of their enterprise sales report that they did recently. I'd really recommend reading it. I thought it had a lot of really great content in it. So I just talked for 45 minutes about this. I wanted to make sure that I saved enough time for questions and discussion. As always, this document's always improving. It's always changing. We'd love to be able to manage any feedback with it. And if you have any questions on it, you can always email me. My email address is mark@danica.com. Or if you have any general questions about Danica, if you're interested in the Danica platform or how we facilitate streamlining digital integration with healthcare customers, you can reach out to us at hello@danica.com. At this point, I know Chris had a few questions and he's monitoring, so we'll take it from there.
Great, thank you, Mark. Yeah, so our first question is if there's going to be a recording of this that people who are here can share with team members who weren't here, and the answer is yes. You will get an email with a follow-up link to the recording of the video. The second question is if you have any companies, Mark, that you feel are a really great digital health product that has kind of broken through within this framework.
That's a great question, and those are a few companies that we work with. I mean, I have a lot of admiration for Propeller Health, who's just down the street from us here in Madison, where, I mean, you can look at their initial prototype, and it's really amazing. Where it was an asthma inhaler, and this was 2012. Bluetooth wasn't quite as mature, with a gigantic battery on it. If you're not familiar with Propeller Health, they have a platform to track people in the system with pulmonary problems, so asthma and COPD, to track how they use their inhalers and other products, to be able to better give feedback to better treat those patients. So, in the past, you had no idea how patients were using their inhalers. You'd only know that a patient was doing good or was doing poorly based whether or not they showed up in the emergency department, which was obviously bad. You had no way to know the climate or allergens or even environmental impacts in your city was impacting asthmatics or patients with COPD. So they built this device to track when patients use their inhalers, which attaches to devices. Now they're starting to build them into specific devices, like with GSK. But it's really amazing how they started very simple, but they knew they needed to have a plan to be able to expand. So it started with the device, but they knew they needed to demonstrate compliance since they had PHI, so they needed to have an infrastructure there pretty quickly. So Greg and the team had to become experts with that. They knew they needed to come up with a framework for proof. So already they were starting to think of clinical trials and validation, where that wasn't necessarily true at the beginning, but they started working on it from there. They built their infrastructure and they started going through the process, and they did their initial audits. They also had specific variations on things they needed to do with the FDA. And then whenever it came down to it, working on data integration, which was a project we had worked on with them, we have a case study on it with the website, where finally being able to push that data back into electronic health record systems so it could be aggregated with other information on asthmatics, so that research could be done on it within the EHR system. I think Amada is another great example where, again, great team of people. I knew some of them through Rock Health back when I was there in 2012. In 2012, Omada wasn't the world killer that they are today in 2017. At that point in time, they just had the basics where, they were selling things off the health systems based on the idea that, yeah, like if you had a program, you could definitely improve the life of diabetics, but they didn't have the clinical studies. They didn't have clinicians on hand. They didn't have hundreds of employees. Then it was a pretty small operation, but they started lean. They knew where they needed to go to, and they knew, again, that to sell to payers involved compliance. They knew that being able to manage their own infrastructure, having application design that restricted access to data, and getting towards that proof component of it was important to them. So if you read any of the stuff, and I think both of those companies have been pretty well documented following their journey over the last 5 years, is a great read on what you need to do to be successful in digital health. Let's see here. See if we have any other questions.
Hey, Mark, thank you. Yep. We have one more question left here. So I think this goes back to your slide on the difference between startups versus Fortune 50, was it? And basically the question is really how different is the DHSF in terms of the priority and things like that between enterprise organizations building products and startups trying to build a business?
Yeah, that's a good question. I mean, it's all about, the way in which you need to demonstrate credibility versus your need to manage risk is going to change between a startup and a well-established entity. So when you're a startup, even, and foolhardily, when I was starting on my startup journey, I was like, well, I worked at Epic. The guy I was starting a company worked with at Epic. Epic has a very good brand. Everyone's going to totally believe us on everything. And I couldn't have been more wrong. I mean, you really got to fight for credibility when you're starting as a startup. Unless you were Glenn Toolman and you were the founder of Allscripts and then you go found Livongo, I mean, pretty much everybody needs to fight for it at the beginning. Even if you're a second-time entrepreneur, whatever it is, like you got to be right. You might know how to be right and get to being right faster, but it's more about establishing your turn or credibility. Whereas, somebody like Johnson & Johnson or somebody like Optum or a large university medical center, J&J's credibility. I mean, they make everything in life sciences under the sun. I mean, they can do a lot of things. They have a lot of interesting ways in which they could package digital health with the existing solutions. But the bigger thing there is risk, right? Where it's that, again, in the event of a breach, and, again, a breach is terrible in any regard, but, if your startup has a breach, okay, your startup goes out of business. Like, that's the worst thing that could happen to you, which obviously would be terrible. Whereas that, for a very large organization with significant revenue, significant business lines, significant PR ramifications, working with PHI and go through their legal risks and be able to go through the machinations of their machine is a much different process, right? And so going through the process in which you can demonstrate that you protect PHI, that you do everything right, that you're doing exactly what you need to do, and providing that value prop is much different. And that's, at a high level how it differs. But again, it's as much the fact that I think everybody looks at the other side of the fence and they're definitely scared of the other people, where large organizations, sometimes worry about the nimble companies and nimble companies worry about the bigger entities. And it's just worth saying that, again, everybody struggles with it. There's nobody who's figured this out 100% entirely. And again, I don't have answers. I just have guidelines on which to come to those answers.